Malaria kills more than 800,000 people in Africa every year.
Just in Nigeria, as many as 300,000 malaria deaths a year, thousands of them children under the age of 5. Young children die from malaria in Nigeria every day.
Now, two faiths united can change that. In a country where the capital skyline is dominated by both cathedral and mosque, what's called the largest collaboration between Christians and Muslims anywhere in the world ever is forming, focusing first on malaria. The Center for Interfaith Action on Global Poverty and the Nigerian Inter-Faith Action Association are working to save lives in a cooperative effort, Faiths United for Health.
We are positioned in terms of material resource. We are positioned in terms of political will and leadership, and the leadership of His Eminence and the Archbishop, and indeed the religious platform, is probably the most significant input that we can make.
The Sultan of Sokoto is the spiritual leader of Muslims in Nigeria.
Muslims, Christians coming together to fight a common cause is of importance to us because we believe that the mosquito does not know religion.
The Archbishop of Abuja is president of the country's Christian Association.
That in Nigeria, Christians and Muslims are working very well together in this area. And we must deliver on this perception, which is a promise on our part, a deep commitment on our part.
We're standing on the precipice here in Nigeria. We have all of the tools in our hands.
We have a collective problem and we have a common challenge.
We need to adopt a new anti-mosquito, a new anti-malarial lifestyle. And it is only the faith-based leaders that are best positioned to carry these messages to the Nigerian people.
The first goal of Faiths United for Health, to help the Nigerian government meet a United Nations target to distribute 63 million anti-malaria bed nets throughout the country. Building broad grassroots support and providing a toolkit for religious leaders with sample sermons for both Muslims and Christians and simple instructions for the faithful, not just to accept bed nets, but to use them.
50 million children have died from malaria in sub-Saharan Africa, 1 million alone last year. These are statistics that are completely unacceptable, recognizing that we can prevent those deaths.
So there are things that we need to do. The environment needs to be taken care of. There needs to be water that's running so that you don't start putting water in bowls and containers. And there's too much pollution, so many things tied to control of malaria.
The disease ruins more than lives and families. Malaria squanders an enormous part of Nigeria's productivity.
The economic loss of that is easily $10 billion a year, each year for Nigeria. So it's not just a human cause, and that's obviously the more motivating factor also for me as a World Bank person, but it's also an economic cause.
International and Nigerian leaders joined to launch the first wave of intervention at the Faiths United for Health Kickoff Conference in Abuja.
We are here as people of faith, and we are united for health. As religious leaders, you have unique access and credibility with Nigerians nationwide.
Every time you are in the pulpit, you say, there is nothing that is impossible with God.
Using your influence, you can save lives. What more can be pleasing to Allah than you religious leaders saving the lives of people?
Here we are asking you, in addition to saving souls, save their lives also. And this is a message I'm sure that you can do because you have the power.
In my community, they say if you save the life of one person, it is like you have saved the life of humanity. If you destroy one life, it is like you have killed all of humanity. So you can save lives.
With God on your side, and God on our side, this will be possible.
The 250 Muslim and Christian clerics at the conference will train others, who will train others, until 5,000 religious leaders in every state in Nigeria are trained to spread the word on malaria, ultimately reaching 25 million people in congregations throughout the country.
The Interfaith Action Association model would then tackle other needs in Nigeria, in Africa, and around the world.
It lays the foundation for more collaboration between the members of the two religious groups, which is very good.
Any house that is divided against itself shall not stand. If we must achieve greatness as a nation, we must be united.
We using the things that unite us to forge ahead in this country as people who believe in God, rather than emphasizing the things that divide us.
Unless we work together, malaria will remain the largest killer in Africa.
By God's grace, inshallah, we shall meet our targets.
Without interfaith efforts, malaria will remain the largest killer in Nigeria.
There isn't anything else that kills as many people. There isn't anything else that causes so much suffering.
With your help, the largest marshalling of forces ever to attack a single disease in a country will continue to gather speed, tackling malaria, then other critical needs.
Here we are asking you, in addition to saving souls, save their lives also.
Christian leaders,
that the whole world is watching this project.
And Muslim leaders,
because we believe that the mosquito does not know religion.
If you save the life of one person, it is like you have saved the life of humanity.
An army of kindness, no barriers separating people.
We must be united.
We are all one.
We are all one.
We are all one.